Hi, my name is Josh Fearing, and I'm going to talk to you a little bit about opioids today. Although people may think of opioids as fairly new drugs that were made in the lab, the concept has been around for thousands of years. From BC till now, opioid drugs are being made in new forms and in new ways. Like any drug, though, it can be taken advantage of in the right way or the wrong way. Why were opioids even made? They were made to help reduce pain in people who have chronic pain. They are now used for people with acute pain as well, but very rarely. The synthetic drugs were mostly given to cancer patients before 1990 to help them with the pain from chemotherapy. After 1990, they were then distributed to people that had just gotten out of surgery to help with recovery time. They were also given to people with chronic pain like arthritis. Here's a list of some opioids. I'm sure that one of you has either been prescribed or know someone who has been prescribed one of these drugs. If you had your wisdom teeth taken out, there is a good chance that you were given hydrocodone. This is not the entire list, as there are more being developed at this very moment. The word opioids can also be interchangeably used with pain medication, analgesics, or pain relievers. Opioids in simple terms is a super strong Aleve or ibuprofen targeted to reduce pain. It also relieves stress by binding with endorphins to create euphoria. Euphoria is a state of being high or feeling very pleased and happy. It also relaxes the body by depressing the central nervous system, so one might feel lethargic or tired. These two statistics should hit right at home for our class population. The first statistic shows the age range of college-age kids. Part of this problem is not all opioids, but also includes the increasing use of Adderall to help college kids focus for finals. The second statistic from a survey done shows that high school seniors willingly misused Vicodin. One could say maybe they didn't know what they were taking, but one can also say some of them were searching for that euphoria. 25% of patients that have been prescribed will eventually use them as long-term prescription. This shows the percentage of people that progress from opioid prescriptions. In the study done at Johns Hopkins Hospital, they concluded that more than 100,000 people have died either from directly being prescribed or indirectly getting the opioids. It is a little concerning that since 1999, deaths have quadrupled. This is because the mass production of opioids that are also being demanded. Heroin use has increased because opioids and heroin have very similar side effects and are made from some of the same chemicals. Heroin produces the same euphoria that the opioids do. People are getting their hands on the prescription opioids, and they are easier to get and feel high than getting marijuana and/or drinking. Opioids and other drugs have been categorized into narcotics by police that basically combine all street drugs as well as opioids. Opioids will bind to the receptors in your body, and endorphins will bind to the receptor as well. The effects of the opioids can be anything from respiratory depression to an itchy feeling. These drugs are so strong and so potent because they affect all the receptors that are both in the central and the peripheral nervous system. This is why it is a drug of choice, because it can help reduce pain in all parts of the body. Prescription opioid misuse varies by age, gender, and many other factors. Other factors include availability of drug, social status, health status, education, etc. Although men have a higher percentage of misusers and higher numbers of death from overdosing, women have increasingly started joining the opioid epidemic. Misuse in older adults or senior citizens is hard to keep track of because they take so many other medications. It may not always be misuse, as trying to get high, as they're not really trying to get high. They may just be combining the drugs with other drugs that they really shouldn't be. Now, there really is a common misconception about these drugs. The general population believes that if a doctor prescribes a drug, then it must be safe to use for everyone. This is partly true, but the drug that is prescribed to a certain patient should only be used by that patient alone. Misuse is happening because people are sharing medication and think that it is all right for one, then it's all right for a couple. Opioids have just as much addictive properties, such as street heroin or crack, to get high. They are just as dangerous, if not more dangerous, when taken in large doses, and they are also taken in unintended forms such as snorting or intravenously. Misusing any drug has consequences that come with it. When misusing opioids, there are multiple things that can happen. The obvious risk with misuse is death by overdosing. Taking a single large dose can also result in respiratory depression, which is the slowing down or stopping of breathing. Substance use disorder leads to clinically significant distress or impairment. Dependence is having a physical discomfort when not taking the drug. And then this can lead to tolerance, which is not feeling the effects of the drug, so one will try and take more than the recommended amount to search for that feeling. After dependence and tolerance, one can end up graduating to addiction. Addiction is a constant search or thought of the drug, heavily and persistently trying to get it. In conclusion, there are many consequences to misusing prescription opioids, but there are also ways out. If you or a loved one finds themselves misusing opioids, they should talk with their doctor immediately. There are also multiple hotlines to call for help if deemed necessary. There are a couple of behavioral therapies that people can utilize, like cognitive behavioral therapy that focuses on ways to cope with wanting the drug. Family therapy is also available that uses the family as a huge support system. It may seem a little odd that someone can recover from drug addiction using more drugs or medication. This is actually very useful in treating addiction. Naltrexone and methadone are opioid receptor antagonists, which stop the drug from creating the feelings that the opioid creates. It helps wean the patient off the opioids so their body doesn't go through severe withdrawal symptoms such as cramps, headaches, and shakes. Opioid misuse and addiction are a prevalent and more increasing problem in the United States. People need to be more educated on the drugs they are taking and what can happen if they are misused. People should also know that if they are already addicted, it is not too late to get help, and there are many options to choose from. We all have to help stop this epidemic by educating and helping each other. I'd like to thank you for watching this video on opioids, and I hope you enjoyed it and learned something that we can all try and help other people in this worldwide epidemic.